Okay, good afternoon, everyone. The time is now 4:03. I call to order the meeting of the Health and Mental Health Committee for August 22nd, 2023. A copy of the agenda for this meeting may be found on the county website under the tab for the legislature. Please silence your phones and electronic devices, and at this time, I ask you all to please rise and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Doreen, can you do roll call, please?
Absolutely. Campbell.
Here.
Anagnostakis.
Present.
Ellers. Luhan. Sutherland. Here. Hotel. Here. Huey.
Here. Okay, first up, item number 1, we have Darcy Miller, Commissioner of Social Services and Mental Health. Hello again.
You've changed.
All right, we have the first item, 1A, is request to create one additional outpatient clinic director, grade 17, and abolish one vacant mental health assessment team director, grade 17. This is legislative request number 188. Can I get a motion, please?
Second.
All right. Okay, Commissioner.
Sure. So our mental health assessment team director retired after many years of great service, 30 plus years in county government. We appreciate. We have an opportunity when we have a retirement to look at our job duties and make a decision. As you know from our previous meetings, we have 18 satellite clinics right now and growing. With those 18 sites, that's that many more staff to supervise and support. So we're taking the mental health assessment team, some of the duties that were connected to that position, and adding the supervision of these satellite clinics that's currently being managed by same grade, a grade 16. So that grade 17 will manage both some of the mental health assessment team duties and the satellite clinics. So we will be replacing the mental health assessment team director with the outpatient clinic director, giving us flexibility in job duties.
And will that be the same person, or are you coming, is it someone coming up from the group, or is it outside?
Yes.
Yes.
Coming up. We have somebody who is currently assisting with managing and supervising those satellite clinics.
I don't take that position. Okay, thanks. Any other questions or comments? Not seeing any, I call the question. All in favor, aye.
Aye.
Any opposed? Okay, motion carries. All right, item 1B, request to accept and appropriate New York State OASIS Office of Addiction Services and Supports funding to support independent living recovery community center programs in the amount of $79,760. That is legislative request number 206. Can I get a motion? A second?
Second.
Okay, Sutherland Hotel.
So this is state-funded programming that Independent Living Inc., Doug Hovey and his team operate. It's located at 17K in Newburgh. Onward Recovery also has the Reach One program, which is a co-occurring program there. But we appreciate the state's additional funds to support the great work that comes out of the Recovery Center. If you're interested in learning more about the Recovery Center, you can go to Independent Living's website and have appreciation for the breadth of services they do there.
Comments? Questions? Okay, not seeing any. I'll call the question. All in favor, aye?
Aye.
Any opposed? Okay, motion carries. All right, next one is item 1C, the monthly update.
Speaking of recovery, September is National Recovery Month. And it explains here, hope is real, recovery is real for the tagline for National Recovery Month. The color for National Recovery is purple, as you can see from some of the flyers. I know Doreen sent you the attachments that have some of the events that are happening. You see purple throughout them, and that's the reason why you see so much purple. We are toying with the idea of trying to get the county government to put some purple font out, to do some purple lights, just to send the message. We still, as you know, struggle with so many who are challenged with addiction. And what really makes a difference is the hope that they can recover and have it be real for them, that there's a system that supports them in that pathway. So appreciate all the efforts around National Recovery Month. August 31st is International Overdose Awareness Day. I also sent you the ADAC sponsored event that will be happening in Port Jervis, and the Team Newburgh, which is Catholic Charities, and Keep It Moving, which is an independent not-for-profit. A mom who lost her son to his challenge with addiction started the Keep It Moving, and she's just incredible in the work that she does, pretty much single-handedly to make a difference in our community. So if you're interested, you can attend any.
Commissioner, what's the date for the ADAC?
Both of them are on the
Oh, they're
31st.
both
correct?
are
They're on the
31st.
day,
Okay,
yes.
even though one's in Newburgh and one's
In Port Jervis, correct.
Okay. Okay, what else you got?
The,
Yeah, you-
nope, I'm just taking this. I just wanted to make note, I think you are all familiar with threat assessment management teams, which following the tragedy, the mass shooting that occurred in Buffalo, New York, it's become mandated for all counties to have a threat assessment management team. There was some funding available specific to that. The sheriff's office led the submission of our application to be able to access those funds. We are currently working as a co-lead with the Department of Mental Health and the sheriff's office. A team of us are going to Albany tomorrow to meet with some other counties who've gone before us in creating the threat assessment management team. And we're doing some additional clinical training. So really, it's an opportunity for the community. If they're concerned about the behavior of someone, the messaging they heard, they're able to report it either electronically or by calling a number that we will set up. They can report a threat and it will be assessed and responded to within a specific period of time. As they answer a series of questions, if it's urgent or emergent, they will be referred to 911 typically, and then 911 and 311 will work together to address the needs. So more on that as we develop and have our portals in place for how a threat can be reported. Just want to say, and I know Legislator Chewy, you were interested in doing a tour of Monroe Woodbury School satellite, and certainly now's the time to touch base with Superintendent, with Elsie, to schedule that, and we'll work together. They have been operating since June and really doing a great job over there.
So has it pretty much been set up and all that because, or is it open for summer school students too?
Open, yeah, it's, the thing with satellites, even though they're in school districts, they have to be year round.
Year round?
Yes, they are year round, and the schools know that when they come in, as you know, schools are open year round, the students may not be there.
Yeah.
But the schools are, and the satellites have to be open year round.
Good,
Yes.
good. Well, I'm sure they can ease into it a little bit.
So please consider moving forward. Goshen is ready to start in the fall. We're really excited for the school year.
What will that bring to number two?
20
20 that have it.
satellites. Now, remember this though, we have to count them. So if you're in, we're in Warwick School District, if we're in 3 different schools, that's considered 3 different satellites. So I believe Goshen brings us to the 8th school district, 20th satellite. Yeah. Well, we got some of the satellites though. We have a satellite in child welfare, we have a satellite in probation, so they're not all in schools.
How many do you have in schools?
The rest.
All
So
of them.
2, 3, so 17. in schools.
17.
Yes.
Okay, that really grew over the years.
I know.
And
It's a lot.
probably isn't too many left to have, you know.
Well, we have 19, we have 18 school districts in BOCES. BOCES, you don't have a state clinic there anymore. Yeah, you still have our RCPC state clinic in your school, right? Very small, but it's there. You could consider a satellite.
Any questions? Yes, Legislator Amos.
Just so I get a feel for it. When you say Monroe Woodbury Satellite Clinic is doing well, how do you define doing well?
Doing well means that they're integrated into the district, they're receiving referrals, they're providing counseling and support to students in the district. That's doing well to me. I'm excited by it. Yeah.
So what, do you have like outcome measures of number of suicides, attempted suicides, and things that you're looking at, or you're just talking about process?
Process, I'll say this, nationally, the average number of therapy sessions that people who are referred attend is one.
Okay.
In school districts, our statistics, we do have stats specific to that. I don't have them, they're memorized right in front of me. But the last report we received, the average number of sessions per student we were providing support to was over 20.
That's great.
So that's really great. That doesn't happen in the community as consistently as it does in the school. You're able to easy access, so no transportation issue. So it's really working out well. But I can share with you that data if you're interested next time around.
Sure.
But you do have, I guess you do have outcome data in your budget. I'm just kind of interested in what
Yes.
you're looking at.
And, suicide is a separate, we have a suicide prevention task force. And I think I mentioned here suicide prevention. Yeah, the walk, the Out of Darkness walk is coming up. I don't want to go into it too deep because I didn't read it fully, but the Surgeon General just put out a report on social media and the impact on mental health and wellness. And I just printed out the summary for that. But directly connected social media to suicide rates increasing. So I want to read that report before I talk anymore about
I'm
it.
interested in something. I think it's, a different way I look at it is that certainly the process data really important because, you're getting traction.
Mhm.
In the structure, you already told me she's already got 8 districts that are doing really well. The one question I'd like to hear about it is how are the clinics doing to get at the outcome? What are the things that were negative prior to us putting coding in place that are now going down?
Yeah.
Where do you go?
Yeah.
That kind of thing, specific to
I
data.
think it's important too. I just want to add another thing for suicides. Commissioner of Health, Dr. Pointer, and our department are working together to put a fatality review team in place with the medical examiner's
Uh-huh.
office, both looking at drug overdose deaths and suicide deaths. So that is going to help us to have valuable information about, was there somewhere in this individual's life where we could have done something different as a system to fill a gap and prevent that death? So that we haven't had that information and that kind of a case autopsy that we'll have going forward. So we just hired the staff for that. Very excited to move forward on that.
Just got chills.
Yeah, that's great. You start sharpening the pencil.
Yeah.
We're getting at it. We're not just talking, really getting at it. That's good.
I just want to add another thing about clinics. Our clinics collect so much data, performance-based data as well as person-based data. And we can pull down metrics from that data that's helpful for us and what we need for improvement amongst our staff,
The non.
both our clinics and our satellite clinics, yes.
Okay, good. This is good, exciting. Thank you.
And just the last thing that I wanted to mention to you all was the Out of Darkness Walk, just so if you're interested in supporting it, is September 24th. And you can access it with the link that you have on this document. I typically try to attend that and acknowledge those who have lost loved ones and the hope message that they're spreading and trying to prevent future death by suicide.
Great. Do we have anything before Commissioner leaves? Thank you, Commissioner.
Thank you all.
Appreciate
Have a
the
good
time.
afternoon.
Okay, next up, item 2, we have Lawrence Ledoux, Commissioner, Valley View Center, and Donna Strecker, Director of Finance for Valley View Center. Welcome.
Thank you. Good afternoon.
Good afternoon. All right, first up, we have item 2A, request supplemental appropriation for proposed capital project number 130 in the 2023 capital plan to replace the blast chiller freezer. Upon approval, a new capital project will be created in the amount of $47,000 bonding. It's legislative request number 202. May I get a motion and a second?
So moved. Second.
Montel and Sutherland. Okay,
Not much more to add. There is, I think, should be some supporting documentation with what,
Yep.
what this looks like. It's a blast chiller freezer. I believe the one that we're replacing is approximately 15 years old, is past its useful life. So we can capitalize on this, the expenditure of this capital project in our Medicaid rate going forward.
Questions?
Who's asked the question?
Slater.
I know we were shipping, is the bonding out of your money?
We're bonding right now. We're bonding.
Who's paying?
We're using serial bonds to fund the
I
capital
know, but
project. We
does
stopped
it
taking it
come out
from
of
the
your
cash.
Yeah.
IDT money or does it come out of the county's taxation?
No, it comes out of our money.
Okay.
We
Perfect.
bond along with the rest of the county, and then we pay the interest.
Okay, good. Yeah, that's fine. Sure, no, I understand. I just wonder, okay, good. Thank you.
You're welcome.
Anybody else? Not hearing anything, call the question, all in favor, aye?
Aye.
Opposed? Okay, motion carries. Item 2B, request supplemental appropriation for proposed capital project number 129 in the 2023 capital plan to continue with residential unit refurbishments. Upon approval, a new capital project will be created, the amount of $40,000, bonding legislative request number 203. Can I get a motion in a second?
Second.
Linda Tortel.
So we've done this one annually for a few years now. This allows us to update the units as necessary. If we need new privacy curtains or handrails or signage or TVs, this kind of gives us funding to do that without having to use our operating budget.
Right. Legislator Amos.
Same?
Yeah.
Okay. Okay.
We'll show you, and then when we get to the financials, you'll see where the debt expense is.
Okay, fine. No, but it's not really big.
Yeah.
Where it comes from is.
Yep.
All right, call the question. All in favor?
Aye.
Any opposed? Motion carries. Up next, we have the monthly financials. And Donna, you're up.
Thank you. The results we're reviewing, excuse me, are at the 6-month milestone in 2023. There's been no change to the IGT. I continue to follow up with Leading Age for updates on when the next payment will be released. I don't have anything new to report at this time. The appropriated surplus that will post at the end of the year, depending on the operating losses from the facility. We have no news on emergency disaster funding. The provider relief funding program is over, so we don't expect to see any new funding interventions in that area. On the other revenue side, we've generated 15.3 million so far year to date through July. On the personal service side, we have expense 11,680,000. On the equipment side, this is the money that we actually comes out of our capital.
Yeah.
Okay, is the 52,139,000. We've encumbered just under 3 million right now that we have an expense for contractual expenses, and we've expensed 5,119,000. The indirect costs will post at year end. Employee benefits coming in at 10,035,000, and a small amount of serial bond debt coming in at the 49,369. That's the money for the bonding. So we pay the interest and we amortize the expense over the course of several years.
With the emergency disaster dollars, there were zeros around. What are they saying on that? Is there?
That was really related. That was,
That was COVID related?
yeah, definitely COVID related.
Yeah.
We ended up receiving, I think, 3 rounds of that funding we qualified for based on the application. So that program is pretty much ended at this point.
In IGT, they just say, no, we don't have any word.
IGT, the state, it's included in the state plan amendment, but CMS and the feds have to come to an agreement on the upper payment limit. and when to release those funds. It is included in the state plan amendment, but the amount in the release is still unknown.
That's unknown. Thank you.
You're welcome.
Thank you.
And the next report that you're looking at will be occupancy. And Lawrence and I have been talking a lot about occupancy this week and looking at our performance. In July, our census, we came in at 64.20, and the average is 63.70. Our admissions director was out, so Lawrence and I were championing making sure that the admissions were coming in. So it was a great learning process. We have a wonderful appreciation for what Heather Sacco does, and you want to
Yeah,
talk a little bit about it?
we went back and compared admissions from pre-COVID in 2019 to what we're doing today. And the last couple of months for 2023, we've had June, we had 22 new admissions. July, we had 24 new admissions. May we had 22, June we had 24, and July we had 25. If we compare this back to 2019, pre-COVID, in May we had 29 in a month, June we had 29 in a month, and July we had 32 in a month. And you have to also remember we had additional 90 beds open back then. So, the issue of census is not getting referrals. We are getting the referrals. We are admitting the people. The issue of census is what we've been saying is staffing and having 90 beds closed and not being able to open another unit. And then, the other piece to that, which I'll get into with my review, is the minimum staffing standards, and we can talk about that next. But we'll start telling you. It's funny, we come in here, we report our census every month, and the census, is been around 64%. You kind of say to yourself, geez, what are they doing over there? It doesn't seem like anything's changing. But in reality, we have had, a decent number of new admissions. But on the flip side of that is also, you have discharges as well. You have deaths, you have people that go back home and transfer to other facilities as well. So, the work is being done. We are making some small wins here and there. And, it's really the factor of where we are right now. Census-wise and financially is all attributed to staffing.
And the new patients are short-term?
Most of them, yes, correct, yep.
Mhm.
And that's reflected when you go to the payer mix, the last page to.
What's the average stay, would you say?
For a short-term resident, I think we average in the 30 days, 30 some odd days. I want to say it's 34, 35, something like that.
Okay.
Yep.
Thank you.
Legislator Anagnostakis.
Thank you, Mr. Chairman. Thank you, Lawrence. Just looking at the census and trying to make details of this thing. Would you say that we're maxed out right now as to how many new residents we can bring in based on the fact of how many people we have employed and the minimum staffing levels that are in place? Are we basically maxed out with that, with those number of employees that we have? In other words, if you were
Yes.
giving 20 new people, you couldn't take them because of the employees.
Well, we may be able to. I mean, if you go to I guess this is a good jump off point. If you go to the minimum staffing reports that I sent out, as you can see, we're making it, but it's not by much. It's for the second quarter of 2022, we made it by 0.25 hours. The third quarter of 2022, we made it by 0.23 hours. Again, the fourth quarter of 2022, 0.25, and then first quarter of 2023, little more than that. So
I guess that's what I'm asking. So if you had
So
an
it-
additional 3 or 4 people.
it's really going to be
that-
tight.
would
These
that
numbers
bring
are
you
going to be
over the
really
level?
close.
It
It's
would
going to
bring
be
you
really
over those
close.
levels,
Yeah,
right?
yeah.
Okay, because if you look at the census, I mean, there is a difference. I hate to say it, there is a difference. We're down like 4 or 5 percentage points from beginning of the year to now, this year versus last year. But yet, when I look, and I'm amazed, when I looked at the revenues, which were 19.5 million this year versus 19.8, it's only 300,000 less in revenues, even though down 5 percentage points in census. And I think that's all made up because you're down 5 percentage points in Medicaid.
Right.
So that's kind of making up a lot of that. Imagine if we could have the census up at the same time that the Medicaid is down, we'd be making some progress.
Right,
But the census is what's killing us.
correct.
It is. And just a note on that, remember, Mike, the 19,522,000 includes the healthcare worker bonus. If you look at that footnote, that revenue is in there, the 420.
So it's actually less.
So 420,000
Just
less than that.
so-
Okay,
right.
so a little less than what I was saying.
Right.
But yet it's still
Correct.
relatively close compared to 5 percentage points less
Correct.
than census.
Correct.
And it's all made up because of the Medicaid decrease. Of
Medicaid is
5%.
down and Medicare is
Yeah.
up.
Right.
Okay.
And you can see that if you look at this analysis, I think Lawrence was pointing that out. I mean, when we talk about, you know, how we're going to strategize it and what we're going to deploy here to, you know, get through the course of the next 6 months of 2023, we have to look at everything. We look at census and then we look at payer source, and certainly our Medicare revenues are, it's a higher paying payer source because it's based on the complexity of the residents coming in. And I think it's important to note, when the state issued the minimum staffing requirements, this doesn't take into account case mix at all. And the complexity surrounding certain residents with, you know, many comorbidities require more hours per patient.
When is the next reval for this case mix?
That's coming up. We have a webinar on that tomorrow.
Well, actually, the state is changing their methodology and there's a webinar on it tomorrow. They're actually freezing it and they're
Right.
going to have a new methodology. We're going to learn more about that tomorrow.
Calculating it.
Yeah,
Any rumors as to positive or negative on the new
it's
methodology?
too early to tell.
Wow.
So, yeah, we literally have a webinar on it tomorrow. So we're going to learn more. Hopefully tomorrow we will report back.
Yeah, if you can let us know. in
Sure.
the interim.
Sure.
Of course.
So the minimum staffing, you just have to keep that in mind when you look here. I mean, this is basically looking at the RN and the CNA hours, and they are basically doing a straight math calculation against the actual census. It's based on the number of beds that we have filled.
So there's two staffing metrics you can look at now in nursing homes. There's the minimum staffing. This minimum staffing, this is the New York State law, and then there's the 5-star. You get a staffing rating for 5-star, but that's a little bit more complicated. That takes into account your census, your actual hours, and it takes into account your case mix. Whereas New York State does not take into account. This is strictly a formula based on staff hours splashed up against census. That's it. And as you can see, you know, for the first quarter of 2023, we were the only facility in Orange County over 100 beds that met the minimum, New York State minimum statute.
So
You know, very good.
Yeah, I mean, but
Yeah, it
it's kind of,
is.
it's kind of sad because, as a whole, the industry can't meet the minimum staffing, and then you have, you know, the other facilities. Montgomery's at 94% occupancy, but obviously they're not worried about that with the minimum staffing. Park Manor's at 93%. They're not worried about that based on the minimum
are they
staffing.
getting penalized for not?
Yes,
Yeah,
yes.
I know.
So in their mind, they'd rather pay the penalty than,
The penalty, the profit on the additional people
Is more than
outweighs
the penalty.
You got it.
What's that, 2,000?
Bingo.
You,
I think it's up to 10,000
Yeah,
per
that's
occurrence if
exactly-
it happens more than once.
Yeah.
You won.
So,
they're willing to take
so
that
it just
risk.
kind of shows you the mindset of the for-profit facilities versus the not-for-profits.
That's all I have.
Lawrence, did you want to go into anything else, legislator?
I just want to ask, Mike really made me think about, he was talking about the census of looking at it, and just me drill into the Medicare. The Medicare data you have here, 12.3, right? Is that skilled bed and rehab bed, or just?
It's both.
No.
Because you can have a long-term resident go out, 3-day stay, come back, qualify for up to 100 days of Med-Aid days.
Right.
We take advantage of that, you
What
know.
percentage do you think, is it more your rehab, is it more your skilled bed that adds up that 12, 13?
Oh, it's more short-term.
Short term.
Yeah, this probably, we had a short-term rehab meeting today. We review all of our Medicare A residents, and it's probably, less than 10 long-term residents at a time.
And the beds you're closing, you have to close down the units are more skilled beds or not.
They're all long-term.
They're all long
So you
term.
put those
Well, actually,
together.
I shouldn't say that. 60 beds are long-term. One of them was a short-term unit.
Yeah, most predominantly,
Right.
you know, Mike, if your admissions are 70, 80%, or your census is Medicaid, and you're closing most of the Medicaid beds down, you know, you expect you're gonna lose those, and that's why things look good, but it's a crazy numbers game.
It is.
I think I think, I just wanted, this might be, you shouldn't probably say, sort of plain numbers game, but when you're talking at the 64.2%, that's a percentage based on 360 beds.
Correct.
Yeah. You see, we should give you credit for managing the place right. If you can't fill those beds because of staffing, you can't do the right thing, why don't we subtract them and give you a percentage against the beds you're really using?
That's how we look at it.
What about the town?
Right.
Because then
actually
you'd be
get
at
both.
90%
Yeah,
of.
Right.
But they're making
Well,
a decision, they're not trying to keep the beds open with
Well-
staff, they're trying to do the right thing.
Well,
Let's not
instead of
beat 'em
making
up
the law punitive, what about a bonus for the facilities
There you
that,
go, exactly.
That-
Right.
that
Yeah, they-
meet the standard? That's not in here. It's just penalties.
Of course.
So, but that's
I don't to give you credit, that's what I'm trying to do.
No, I understand. We appreciate
We
that.
appreciate that.
So, I mean,
Because it
we-
really is, you have to make decisions. Hard decisions have to be made.
But when you think about it, actually, you're right. I mean, if you close down X amount of beds and you don't have staff for those beds because they're closed down, that's not part of the facility anymore. What is part of the facility is the beds that you have and the staff that you have. And the question is, what's the occupancy there? It's
Exactly.
probably like 92%.
And also based on on the listing with the required hours, right? I mean, you put all three of those together. And your max,
But,
your
the kind of
max with
the point I was making,
the patient to nursing ratio.
the point I was going on the record with,
Based
is
on-
let's give
Oh, yeah.
We have a little
value
wiggle room
for
here.
doing the
a
right
little.
thing when they know they can't deliver the highest quality of care because of staffing.
Right.
The right thing is to close on the bed. You can't do a good job
The,
because you haven't got enough staff.
the
So
problem is.
why penalize you?
The problem is we can't get to the levels we were 3-4 years ago,
Correct.
for 4 years in a row where we were turning a profit unless we get them
We're-
back up.
I think we're gonna have a conversation with, our accounting group about decertifying beds, because Donna and I have talked about that.
Yeah.
And
Yeah.
it may be time,
Yeah,
okay, so.
If you decertify, can you bring it back? I mean, you're gonna be losing the money.
We have to, that's what.
I don't know.
That's a negotiation.
It's a process
We have to
and,
negotiate that.
yeah, so.
Yeah.
There may be incentives for us to do it.
Right.
We may be able to, negotiate something, so we'll see.
And remember the capital component of the rate, right? The way that they calculate it, you get a higher rate if you're 300 and above. When
So
you're
you wouldn't want to go below
300
that.
and below,
There's a lot of things you have to think about.
so there's a lot of moving parts. So the max that we would want to decertify,
300.
It's a numbers game all right. Every time you turn around, it's another number.
Numbers game. Calculate.
you're
Want
welcome.
to go into your update?
Yeah, we talked about, I did have a couple of typos in here, I apologize. I talked about the admissions or our current census. We did, we did hire a full-time LPN and an RN. They started last week, so that's good. I keep telling Donna and the rest of our staff, we have to celebrate little wins and keep building on them, so that's excellent. Our CHA is doing well. Our census is 14. The CHA had new 9 admits and 5 discharges and conducted 168 therapy treatment sessions in July. Should be
Great.
July, not June, so that's great, yep. We do have 2 COVID positive staff, no residents. We're waiting to hear back from the New York State Department of Health as to whether we're back in compliance for our Medicare recertification, and we talked about the minimum staffing already.
And Lawrence and I are meeting with all the new employees when they they come in for some in-servicing prior to the actual start date. So we have been going in and talking with them and asking them why they chose Valley View, and we've had some interesting information, right?
Yeah, and we're sharing with them the minimum staffing information, and this is positive for our staff. It's a good marketing tool as well,
Yeah.
so. Yep, just continue to plug away.
Very good. Any other questions or comments?
Thank you.
Okay. Thank you very much. Thank you. Appreciate it.
Last agenda item. Yeah.
Okay, next up, we have item 3. Dr. Alicia Pointer, Commissioner, Health Department, Lisa Kayla Hiff, Deputy Commissioner for Health Department. Hello, good afternoon. First up, we have item 3A, request to accept and appropriate funds from the New York State Department of Health for long COVID-19 initiative for the period of 5/1/2023 through 2/15/2024. The amount of $35,528.75. That's legislative request number 196. Motion is second.
So moved.
Platel and Sutherland.
This grant is specifically from the New York State Office of Minority Health. So it's looking at the effect of long COVID on minorities in Orange County. This is a quantitative and qualitative study. So it's using our extensive line list that we had during COVID, survey based on that line list. And then we're also doing interviews based on people who would choose to also talk about their experiences with us. Looks at their long COVID experience, rates of long COVID, also looks at their ability to access resources in the county and what long COVID resources we have locally.
Now, what about other groups that have long COVID?
That's a great question. There are a lot of resources out there in the past, probably the past 2 months. The state Department of Health, the state government, and the federal government have just started putting a lot of resources into looking at long COVID because we're now seeing these effects that are continuing to last for a lot of people and seem to affect different people differently. Initially, long COVID was and it still is in some ways, this huge constellation of symptoms that may vary significantly from one person to the next and may in fact be completely different illnesses or syndromes from one person to the next. So that is being looked at the state and federal level. We're hoping that this survey and, some of the questions that we ask people will give us information about general long COVID resources too. Exactly.
Great. Any questions, comments?
Just one question.
Legislator Raymond.
I didn't see the list. Where are we standing in terms of COVID right now?
That's a great question. So rates are increasing. We know that rates are increasing in our county based on our wastewater data, which we've seen increases over the past 2 weeks. And also based on reports from our
I think
healthcare
that's in your
facilities.
update.
No, I didn't see.
I did not put it in my
I didn't see
updates.
it.
No, okay, I just thought that there was something.
You guys are so used to seeing it there. And when
Yeah.
There's nothing in there.
when I finally took it out, I don't know, it
Yeah.
serves me right, yeah. But yes, so rates are increasing. We're seeing that in our healthcare facilities, our long-term care facilities too. So we're getting reports and seeing it in our wastewater data. In the county right now, there are no variants of concern that have been circulating. Most of what we're seeing is this Omicron XBB, which is a variant of interest. But we do look at the genetic fingerprints of the COVID variants in our county, and there aren't any variants of concern right now, but we'll keep a close eye on that.
Is the spread randomly even across the county, or is there any hotspot here, hotspot there?
Right now, it's pretty even. I would say over the past few months, we've seen hotspots here and there, and we do send out information to those areas that have hotspots. So we'll typically send a letter, because we can see based on where the wastewater is collected, we'll typically send a letter to the superintendent of schools, if there is one in that area, hospital, if there is one in that area, and the mayor or town supervisor. And then if there's a long-term care facility in that area, depending which municipality it is, informing them that you're a hotspot. And we have criteria that we use. So based on percentage of positivity in the wastewater and also percentage increase. So over the past few months, here and there, but rare, we haven't had to send too many of those letters. The past couple weeks, We get a color updated map every week from the state, and I would say, I'm seeing large portions of the county go from that kind of like yellow to orange, some to red. Rates are still low compared to what they've been in the past, but right now, we're getting close to where we were maybe 5 or 6 months ago.
And then with some new variant B, something or other, we're not seeing that here?
We're not, we're only seeing so far this XBB, which has been around for a while. So what's been prominent in our county for the past couple months is what I've seen. No other variants of concern right now, but we are keeping track. I think I got another alert today about a variant that's being closely watched. So we are keeping an eye on those. And we get a list of variants of concern and then whether they're present in the state. So whether we see them in New York and then whether they're present in our county. So we do get that weekly too.
The number of deaths in the county have gone down, maybe to none attributable to COVID, or there are still deaths?
We don't have the data on that we used to have because it's just not being tracked as well. So I don't have a good answer for you on that. I can say that hospitalization rates with COVID have been relatively stable, even though we're seeing this increase in our wastewater. But even that data isn't being tracked as closely as it has been in the past.
Thank you.
Okay, back to the resolution here. We'll go into the discussion. We'll call the question. All in favor?
Aye.
Any opposed? Motion carries. Okay, item 3B, no, that was 3B, right? A, request to accept and appropriate funds from the New York State Department of Health for the Tuberculosis Prevention and Control Program for the period of 4/1/2023 through 3/31/2024, the amount of $25,563. Legislative request number 208. Can I get a motion in a second?
So moved.
Town, Sutherland.
We have a tuberculosis clinic already in the county. This is supplemental funding for tuberculosis diagnosis and treatment of anticipated Ukrainian refugees. So this is the it's called the U4U program. The amount was based on our population and the number of anticipated refugees. However, we don't have very many Ukrainian refugees at all in the county, and this funding can be used for any refugee or asylum seekers tuberculosis needs. So we really have a lot of flexibility to use this funding. So it's primarily used for tuberculosis testing and then latent tuberculosis treatment as needed.
Any questions? But I think we do have some in the county.
We've had a few, but a far smaller amount than was anticipated based on this grant,
Okay. All right.
which is why we appreciate the flexibility to use it as we see fit.
Either one.
Mhm.
Okay, that's great. All right. Not seeing any other questions or call the question. All in favor?
Aye.
Opposed? None, motion carries. Okay, item 3C, request to accept funds from the New York State Department of Health for the Adolescent Tobacco Use Prevention Act, ATUPA grant program for the period of 4/1/2023 through 3/31/2024, the amount of $97,198. Legislative request number 220. Can I get a motion in a second?
Second.
Sutherland,
Second.
Michael Emo. Okay,
We call this program a TUPA. It does cover, as noted, adolescent tobacco use prevention. So we do youth checks to ensure that people are following the laws and not selling tobacco products to minors. But we also look for other things too. We do education. We have adult checks to make sure they have appropriate signage. They're not selling things that they're not supposed to. We also do our flavored vape inspections under this program. This has been a long-standing program that the county has had.
how often are those groups going out to check up your
Yeah, so I could tell you, I actually have the 20 So in 2022, we did 238 compliance checks with minors and 368 compliance checks by adults. To give you an idea, that's increased significantly this grant year. So this grant year actually started April 1st. And for that first quarter, we had done 177 compliance checks for minors. So we really are trying to ramp up this program. You know, we're seeing people with flavored vapes. That seems to be what a lot of the youth are buying more now. We had seen that youth weren't buying cigarettes as often, which was great, that they were kind of turning away from tobacco. But now we see this uptick with flavored vapes. So we are trying to make sure that we stay on top of it and make sure that no one is selling things that they shouldn't be.
Legislative Anagnestakis.
Thank you, Mr. Chairman. The FDA was gonna potentially, was looking at banning menthol cigarettes. Where do they stand on that? That was happening, they've been looking at it for years, but
Yeah,
I thought they were potentially moving on it at some point, like this year. What's the status?
so that's the plan. So New York State, as you may know,
And that's a
was-
federal, that would be a federal,
it would
issue.
if the FDA did it,
Yeah.
yes. New York State was looking to do it in the budget. This year it didn't go through. The FDA has talked about it before too. This isn't the first time that it's come up at the federal level. It tends to get stalled for a variety of reasons.
because of the lobby industry, the cigarette industry is powerful.
Yeah.
But supposedly they were moving on it and Biden was behind it and they were gonna do it and I've not heard any progression on it.
Yeah, it has not happened yet. I can tell you that.
And then my understanding, help me out with this. If they were to do that, the cigarette companies couldn't have the menthol in the cigarettes, but then I've heard that what they would do potentially would have like little menthol capsules within there that the customer would break and put into the cigarette and have the same flavor, and they couldn't be stopped from doing that.
So this came up with flavored vapes actually. So flavored vapes other than menthol flavor are banned in New York State. And they managed to ban not only flavored vapes that contain nicotine, but also flavors that are meant to be used with nicotine. So that kind of, you know, trying to get around that you're talking about. So New York State was able to do it where they said, if this is a flavor that's going to be used with nicotine, even if it doesn't contain nicotine itself, it's still banned. So there are ways around that. I'm sure that the companies could also try to get around it with the marketing, but I would hope, and I'm not the one who designs these policies, that they would model it something like that, where if it's a flavor that's meant to be used with tobacco, that would also
I
be
think
banned.
it still has to play itself out. Right?
Yeah,
So.
we don't know yet. We don't have a great
All right,
answer yet.
Okay. Call a question on the Adolescent Tobacco Use Prevention Act grant. All in favor? Any opposed? Motion carries. Next up is 3D, request to create 9 transporter ME's office positions, grade 6. Also request the title of per diem transporter ME's office be created. The salary range for per diem will be from $21 to $25 per hour. That's legislative request number 209. Can I get a motion and a second? Sutherland,
Second.
second, Tortel. Okay, Doctor, if you wanted to go into this a little bit, I know that it was discussed yesterday, personnel and compensation. So I know there was some more information that was requested of you.
Mhm.
I don't know if you have some now or if, you know, we're gonna take the time to let you gather that also. But if you want to tell us what you have right now.
So I'm happy to answer some of the questions that came up yesterday. And then we can certainly take your questions today and over the next couple weeks.
And also, if you would like to put everything together, and then come back to both committees next month. You know, I'd like to put the option out there to table this until next month.
Yeah, I would be happy to do that. I can answer a couple questions right now. And then whatever questions you have today, we can bring those back and get those back to you within the next month and discuss it again next
Yeah,
month.
I think I'd like to ask for a motion to table.
What happened in yesterday's, the other committee? What happened in the other committee? Did that pass and go through?
No,
It
they needed some more information.
got tabled.
No,
No.
failed.
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 Okay. We could table it here if you'd like.
Or we could just go and, I mean, does anybody have any questions?
I can also
I don't have
answer
any.
some of the questions that came up yesterday.
No, I know that, Chairwoman,
I would suggest that, thank you very much, Dr. Pointer, you seem more prepared to discuss this, and I think that might be very, very helpful. It was a thorough discussion yesterday. I think, we were all there. And eventually it failed for lack of some information that legislators were requesting. I think you handled yourself, both of you, very, very well, very professionally. And I appreciate you very quickly coming to this committee with some additional information. I think it's only fair that she has the opportunity to kind of give you a little bit of insight as to what's going on, because if we table it, then she can't speak.
okay, all right, okay,
To make a long story short,
okay.
But you can understand what after she speaks.
afterwards,
Good morning.
and I
Yeah,
would
yeah.
suggest that.
Okay,
So we talked about this as a group a little bit last month, so very broadly, this involves the transport of decedents from the place of death, whether it's in a person's home, other places in our community, or the hospital, to the medical examiner's office. And these are deaths that are either unnatural, suspicious, unexplained, and are determined by our medical investigators in consultation with the medical examiner would need to go to the medical examiner's office. So not all deaths in the county end up there. As we discussed last month, we had 514, I believe, transports in 2022. We're on schedule for about 550 for 2023. This is a role that funeral home directors had done for us in the past at a cost of $250 per transport, but a role that they have declined to do in the future. They informed us a few months ago that as of January 1st, 2024, they'll no longer be taking on this role. So we appreciate their help for many years they've done this. One of the questions that came up yesterday was what kind of deaths require transportation? I touched on that briefly. So violent deaths, criminal, any kind of unexplained manner, deaths that are, attended by a physician or are natural, don't necessarily have to be transported. One question was whether the funeral homes had notified us that they would no longer provide this transportation in writing. They did, and I'll send this out to the group, but I do have a copy of that letter that I can give to you today. Actually, do you mind? Nope.
and you'll send it to Doreen that way, you can send it
Perfect,
out
thank
to,
you.
all the other.
Wait, I'm gonna separate it out, so I don't have to go through all those papers. So I have a copy of the letter that they initially sent us, and then there's a copy of the email that they sent us as a follow-up. And that kind of addresses the next question, were the funeral homes offered more money? I'm sorry, one more thing, please. Don't leave you standing.
Okay, no problem.
Were they offered more money to continue to provide this service? That email does contain this line, I assure you, the Orange County Funeral Homes are not asking for more money. We did meet with them in person after this letter and email. They started that in-person meeting with the same sentiment, that they were not requesting more money. They cited age, lack of available staff. There are fewer funeral home directors now than there used to be, and they're getting on in years. One comment that was made was funeral home directors don't retire, they tend to work until they're incapacitated. Another question that came up was whose responsibility is it to provide for the transportation of decedents to the medical examiner's office? if a decedent is going to the medical examiner's office, if that's determined, then it's the medical examiner's authority to remove the decedent, transport the decedent, and take charge of that. So it's the county's responsibility. And then the biggest question was about our overall approach. As I think we talked about last time, we are putting out an RFP for a contract for this service. And we're hoping that that RFP interests a contractor who's willing to take this on. However, we know that come January 1st, we're not going to have the service provided to us by the funeral directors anymore. And we need to make sure we have another solution in place. So that may involve contractors who reply to this RFP. It may involve other contracted employees, but we want to make sure we have as many options available as possible, which is why we also were asking for these positions, because we know that it takes a while to hire people. And if we needed some combination of those options, or if a couple of those options didn't work, we wanted to make sure that we had a backup plan. And that's what these positions are. Another question came up about the number of positions that we would need specifically. Oh, we had a couple more questions. Can anyone provide this transportation? So there are no requirements that the transporter has to be the medical examiner or has to be a licensed funeral director. Our RFP does have some requirements in there, so they have to have an appropriate vehicle, they have to have a license to drive. They have to, handle the decedents in a respectful manner, so those are included. And I wanted to bring up the 9 positions. So I just handed out kind of a description of the staffing needs. I'm gonna actually let you guys look at them too, I think, because it's easier. I think it's easier to see it. Is that okay?
I can
Oh, thank you.
Do you need some more copies? I'm not sure.
I think I'm good.
Okay.
I think that's,
So this one's good for now?
yeah.
Okay.
I got one.
Yeah.
You had just said that there was no law requiring that the body be handled by a medical examiner.
That it be transported by the medical examiner.
Be
Yeah.
transferred by the medical examiner.
Or by the funeral home. We are responsible for it, but there's not a law that says the medical examiner has to be the one to do it, which is how the funeral directors.
What if it's, like you said, a suspicious death or a homicide,
Mhm.
something along those lines? How does that work with what the police department refers to as, I think, chain of evidence?
Yeah,
So how does that play in if you're gonna have a layperson
right.
in a unqualified vehicle? You're saying a vehicle, so I'm thinking minivan or something along those. It doesn't seem,
Yeah,
how do I say this, appropriate,
yeah, that's a good question.
kosher. I mean, they should be, first off, they should be transported, obviously in a body bag, on a stretcher that's locked into a vehicle
And we
That's
do
in
have
the
those
RFP.
and
requirements,
strapped down. I mean,
Yeah.
I don't want somebody,
of course.
I'd like to just ask, I mean, not sorry, Lori, but with the RFP, won't this all be laid out in
It
the
is.
RFP?
Yes, we mentioned the
And that's
body
why I think
bag.
we had some
yeah.
discussion yesterday about it, because, there's still information that need to get, that's coming out today. But as far as the exact details and what's required, I'm sure that would be laid out in any RFP.
It is.
Right, we're-
I want to finish my
Sure, go ahead.
questions. So you're saying that out of these 9 people that you want to
Mhm.
hire, will they be now using county vehicles and be a county employee, correct?
Yes.
And will be trained by the medical examiner on how to properly handle this. Are there any qualifications within in here that they have to have some type of background on this? I didn't see that in here.
So I'll try to
I didn't
answer.
see the background on here.
Okay. So I'll try to answer, oh,
If I could just, all of these deaths would be initially responded to by a medical investigator from the medical examiner's office. That person, in consultation with the medical examiner or the physician who is acting as locum tenens, medical examiner, would have a consultation and make a determination as to the need to go to the ME's office or not. In those types of where there's evidence that needs to be kept, the medical investigator would take charge of logging all of that and making sure that that was appropriately transported.
Transport.
They then-
Would the medical investigator be the one who transports with the body?
They follow the transporter.
so
And
they'd be
then,
on both sides,
Right.
at the scene and then again at the
Yes.
medical examiner's office, but wouldn't necessarily be with the body the whole time. But any evidence that needed to be collected could be done at the scene if necessary.
and that's what's done now with the funeral home that picks up a decedent in this type of situation. The medical investigator goes with the decedent and the funeral home director to the ME's office and does the appropriate check-in process.
The stretchers, and it does say in the RFP that they need to have an appropriate vehicle, which gives us flexibility to say, we don't think this is respectful, or we don't think this is appropriate. They do have to get, the vehicle approved too. So I think that answers some of your questions, but these specific staff members, yes, would be county employees, and in this case, we would have county vehicles. So if we didn't have this initial RFP go through successfully, then these staff members would have county vehicles. And to answer your question about qualifications, so there are not really qualifications other than, age qualifications. They need to have a clean license likewise. I think we do talk about having a respectful, it's not a respectful attitude, but you kind of have the idea, and would be interviewed first, by the medical examiner's office and made it clear, this is an emotionally challenging and physically challenging job. So it would be made clear what the expectations were, and what some of the challenges could be.
Thank you.
Okay, you know what, I'm just gonna, I know you have more information, but just while we're on it, I'm gonna take a question from legislator Amon and a question from legislator Nagustakis, and then I'd like to have you take the floor and then you can give the rest of the information that you have.
Yeah, just to separate, the RFP is one thing, it's yet to come. We'll find out later that I've had a lot of experience and I'm excited about these RFPs. But this is not going on. I'm not so worried about that qualification because you're gonna be able to vet it, that people are gonna be. The softball question I'd like to give you is, and I think you should have had it in there, is what's your training protocol with people you hire? Because it's correct. In the job description, it talks about somewhat of an understanding of dealing with someone who's deceased and the circumstances. When you look at the qualifications, it doesn't really talk about that. And I think if you just said in there, and once hired, because they're county employees, we're gonna train them how to do all this. And I'd be 100% voter when you said that to me. Because I think you would do that, you will train them. Of course you will, if they're your employees, you're gonna train them.
Right, and our
RFP, no, that's a different story.
Yeah, and our medical investigators have been doing this for a very long time. They're fantastic. They've worked very closely with the funeral home directors. And they certainly have the capacity to do that training. As I mentioned, they'll be there with these transporters at the scene because they have to be. And that would be a really great opportunity. It's not like these transporters are gonna show up by themselves.
It's on the job training.
Exactly, it will
Thank
be
you.
on the job training with our very experienced medical investigators who will be there guiding them through it.
Okay, that's all. I want to clear that up because I knew that was a weak point tonight for me at least. Okay,
And that's the same with either scenario, whether it's a company that comes in on the RFP or if it's employees that get hired by the county, by the medical examiner's
I think,
office.
I think it's going to be more strict with the RFP because you're going to demand
Right.
what you want.
Yeah.
You may not think everybody have a mortuary license, I mean, you could.
Both
You can say,
scenarios.
somebody might come in and say, we got all these people with this background, you got one, you can demand it.
Okay, Mike,
Thank you. I just want to try to put a few things in perspective, at least for myself here. I remember from the last discussion we had a month ago here, correct me or refresh my memory. The bodies are kept somewhere. They don't have to be picked up right now, right?
Well,
I mean,
in many cases, they do have to be picked up right away. So it depends where the death happens. If the death happens at a hospital, then in many cases, the hospitals will kindly keep that body for us until we're ready to pick them up. So there is a slightly higher need for this during the day because the hospitals can hold on to the decedents for us until the daytime when we have more staff. But if there's a death anywhere else in the county, they do have to be picked up urgently, and we're requiring within 60 minutes.
okay. Thank you for clarifying that up, because that's not the way I remembered. I remembered the hospital part. I didn't remember the other part. Now, you said last year there were 514 that went to the
Yes,
ME. Can you tell me how many people died in Orange County last year total?
I don't know the answer to
Can you
that.
give a rough estimate?
I can't. I don't even want to try to guess. Your question is like what percentage of deaths end up going to the medical
That's the
examiner's
question,
office?
yeah.
Yeah, and I'm not
You can
sure.
answer that.
Okay, because 514 or even the estimate of 550 this year,
Mhm.
again, simple math tells us that it's somewhere in the order of 1.5 per day. I
Yes.
understand, maybe one day there'll be none, and another day there'll be 2
Mhm.
or 3, and 2 or 3 days there'll be none, but it averages out 1.5 a day. So,
Yes.
you know, when you say vehicles, I don't want to, I'm not thinking of this as a mountain, I'm thinking of it a little smaller than a mountain.
Mhm.
Vehicles, if we're only 1.5 a day, I don't see why we need one vehicle would be able to go and pick a body up and go and pick another body up if it had. And so that's my concern, keeping in perspective the numbers that we're talking about.
Mhm.
Because the 250 that you were paying would work out to about 135,000
Yes.
this year for 550 estimate.
Yeah.
But the 6 people, even at, I'm not even factoring in all of the benefits, is gonna be well over 500,000. So so I'll let you continue.
Agreed. So I gave you all this sheet that talks about decedent transport staffing needs. As we talked about, we would really need 24/7 coverage if we were to use only county staff. So this doesn't account for vacation, sick, time off. It also doesn't account for if we ended up doing a hybrid model where we had some contracted staff and some county staff. So this would be only county staff. And I have my math at the top, and then I'm not a scheduler, but I tried to make a fake schedule with these colored people. Basically, we're looking at 7 days a week, and I counted about 3 8-hour shifts per day, which is 21 shifts per week that would need to be covered in total. And then I multiplied that by 2 because we would need 2 people per shift in order to transport these bodies, which gave us 42 shifts that would have to be hired for total. So if you count up all these little people on my schedule, that would be about 42. And I assumed each person would do a 40-hour work week. So about 5 8-hour shifts per person. And that got us to 8.4 people, but because we can't hire half a person, we rounded up to 9 people. As I mentioned, this doesn't include, people calling out, which is why we also requested a per diem position to be created in case we needed that. If people called out, people were injured, we understand there may be needs for that, but you have my math in a couple different ways to look at there.
thank you. Cheryl?
Just to kind of sum up, yesterday a comment was made by legislator Brescia, and I think it bears repeating here today as well, is this has been an issue that we were notified of years ago. And then COVID hit and a lot of things fell between the cracks. And you've only been here a short period of time and you've inherited this. And I want to applaud your efforts along with your staff in addressing this and reminding everybody here today that this is a backup. If the RFP, which was supposed to go out either yesterday or by Friday, correct?
Yep,
If that works, then all of this is for naught.
right. We just want to have it
So
in our
I
back
think you
pocket.
need to remember all of that in the deliberations. But in fairness to the PNC committee yesterday, it failed by a 4-3 vote because of outstanding questions. And in talking with people, it appears that you could bring this back to committee next month with the additional information that may be still outstanding, and we can still get it on the session, and you can still be moving ahead with your backup plan. And by that time, we may even have some information on the results. So you're mentioning to table this for the month. I would suggest that that might be a very prudent move at this time. But knowing that we have to do something. And here again, applaud your efforts for being very proactive with this. Appreciate it.
And just also, if you, all the information that you gave to us today, if you could get it to Doreen so that she could send it out to all legislators,
We will.
all legislators in preparations of next month's meetings.
And certainly if there are any other questions that come up as you're looking through things, please email one of us and let us know. We will provide that answer for all the rest of the information.
That's great. And if you could put that in the little cover letter, you know.
Yes.
Hey, Chairman,
Yes, sir.
I'm just listening to this in the other room. We have a great health commissioner. We've gotten this problem on us. It's uncharted territories. She's making a great proposal. If she doesn't have the answers, I don't think she does have all the answers. And I think like you're asking some great questions. There might be too many vehicles, Mr. Mike, but I don't think they're gonna be sitting there. Let her try this out. We're walking into what's gonna probably be a crisis soon. We deal with this all the time. So I would just, in my opinion, let her put her proposal through, massage it if you guys want to. If we have to make changes mid-year, let's do it. But I have my utmost confidence in what they're proposing from the health department. She's done a great job. I've heard about the drama and a lot of questions and uncertainty yesterday, but there are a lot of uncertainty. This is not our business. We've never done this since this county was founded. Moving bodies and bringing them all over the place and bringing human remains. That's not our job. It's usually brought to us. Let them give a proposal. Let's give it a shot. And if we have to massage it, let's massage it, guys. But in my opinion, I think we're just like weeding this down and none of us have ever done this before. So let her do her job that we hired her to do. That's my only input on this, guys. I'm with you on it.
Question.
Legislator Nagus.
Thank you. Doctor, surrounding counties, how do they handle it? Putnam, Dutchess, Ulster, Sullivan, Rockland, surrounding counties, how do they handle it?
That's a great question, and I can tell you that after talking to many of my counterparts, no county has a perfect solution. So there's a variety. Some hire contractors, like we've talked about doing.
They put an RFP out, they bring a contractor in,
Exactly.
which we're gonna do, we're gonna be putting an RFP
We're
out.
gonna be putting an RFP out.
Okay, go ahead.
Some counties do that. Some counties use funeral home directors, as we have in the
So
past.
some of them continue, the directors continue
Yes.
to do it, and what do they pay them, do you know?
It varies, but it is for the most part more than we have been paying our funeral home
Double?
directors, to be
Five
fair.
hundred?
About 400 to 500 is what I've seen.
Did you say you offered them a
We-
higher amount?
We did not. Via email and in person, they told us twice that they were not interested in more money, and at a point, it almost feels insulting to offer after they've told us that that's not.
Is there
what they
anything else
want.
any other county does?
Yes, some counties have their regular staff do transports, so that would be either their autopsy assistants or their medical investigators. I can tell you that this.
People
this
that you
is-
already have employed
Mhm.
in your department, your counterparts have those people go out and do it.
Yes, but in those counties, that's a condition of being hired, so people know when they sign up for the jobs that that's what they're going to be doing. And part of being hired is that they have to be physically able to do that. And I can't guarantee that our investigators or our autopsy assistants are willing to do that or physically capable of doing that, but we have talked about the possibility of changing job descriptions in the future for new hires to incorporate that. That would be something to think about moving forward.
Is there anything else in the other county does?
I believe I covered all of it. Some do a combination of those, where they may have, a couple funeral homes that also have a contract. So they've contracted with funeral homes. Some places do that. Some places have people kind of after hours and then their own staff during hours. So, but those three things or some combination of them. Despite that, no county has said that they're satisfied with what they have. Each county has raised issues, whether it's delayed response time, increased workers' comp, because this is a physically demanding job. Some places had funeral home directors do it and were dropped and had to find a solution within, the month. So even, a more difficult situation than us. But that's the variety.
Okay, thank you.
Okay, so, the RFP is going out this week, you said, right?
Yes.
Betsy, we don't have to vote on that for the RFP to go out.
No.
Okay. So,
Karen?
yeah, I see your hand. So I'm just wondering now, if we wait for this to come back next month, because you're gonna have to come back anyway for P and C. That,
No,
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 we
failed
don't. Oh, it's
PNC.
failed, so that's it.
It's not going to PNC.
So the options that we have here is to either vote on this today or table it and bring it back next month.
Correct.
Those are the two options.
Well, for point of information, nothing prevents them from going back to PNC with a revised proposal that they might have.
I don't see a revision happening because it's a very specific request.
Well, I don't know what the doctor would have in her mind and what she would come up with, but I'm saying if she came up with a revised proposal, nothing as a point of order would prevent them from bringing it back again to PNC.
If it is the same request, it will not go to PNC. If there is some change in it, there's
Right.
potential for it,
Right,
yes.
okay, thank you.
Okay. Chairwoman, do you have anything you'd like to add, or
I've already said how I felt about it.
what you'd like to do?
Yes,
To table. So you need a motion to table it.
it would be a
correct?
motion to table or take the vote.
Yeah. I just think, in fairness to what the meeting yesterday and to all the legislators, that they could have that time to read it, as long as it's not gonna hold up the RFP. And then we vote on it next month.
I don't see that holding up the RFP. The only thing it would hold up is, once the positions are posted.
Once the RFP goes out, then you're gonna have 30 days to wait to see what happens. And the funeral directors are definitely out. They're not gonna even hang around for 2 weeks or a month or anything, right? They're done.
From what the Funeral Directors Association has told me, I haven't spoken to all of the funeral home directors individually, but from what the association has told me, they are out as of January 1st.
Oh, question.
Yep.
Is there, have we thought about contacting individual funeral home directors who might want to take this duty on themselves? Director A from Port Jervis might say, I'll do it for the whole county.
And they could certainly respond to the RFP.
Right, okay.
And they very well-
Okay, Legislator Totel, then Legislator Amo, and then we're gonna move on.
Thank you.
I fully believe that we should take a vote today. And the reason being is we are in August. The next meeting that it would be able to be voted on would not be until October, which we're going to be starting into budget season on that also. Not only that, the job has to be posted, the interviews have to be done. what's it take, 90 days from the day of job posting before, or 60 days before the person is actually on the books hired in county clothing and working? So if we delay this until then, we might be caught without the ability to handle a situation once it comes up to January 1st. And I personally don't want to take that chance. I think it's prudent what is being proposed. So yes, there are some questions, but as our county executive pointed out, it is uncharted territory. And also, I personally think that if we have, yes, I understand the additional expense and I understand the budget process, but if we have a county employee who is handling the remains of somebody's loved ones, and it's even taking them to our medical examiner's office to have a autopsy, which is traumatic enough for the family to have to deal with, we should have it under our own quality control. And that's my feeling on it. We should have it under the quality control of our medical examiner and our commissioner of health.
Legislator Amo.
Yeah, I think part of what Lori said, I agree with. And I haven't heard it here. I heard the county exec, and I think he's spot on in terms of the way he presented. And then my biggest concern is just that, is we've seen RFPs come out over the years that we don't get anybody, or we get 3 people that we don't like, and we're stuck. And now we don't have this in place, and it's January 1st. What's our alternative? Can the county exec put an emergency order and hire people on the spot? As long as we cannot lose that opportunity, I would hate to see the commissioner come up to December 31st and have nobody. And everybody's walking away. I want to see that we got a safety net here. And the way I see it is if we vote for this and the vote, if you count the votes and the votes are here, then at least it goes to the floor. And if the floor wants to kill it, they can kill it. But at least there's an option to see what the heck's going on. But I'm worried about that. My only worry, if somebody could assure me that, don't worry about it, Michael, it's okay, we'll take care of it. I'm on board.
I just want to
support
clear up
you.
something that I think might have been misinformation yesterday. One of the legislators talked, and you had mentioned 4 shifts, right? Wasn't it 4 shifts? And that's how you came up with the 8.
3 shifts a day, yeah.
3 shifts a day.
Yeah.
You had, you need 2 people.
Yeah.
And then if you look at that, and I think with the amount per hour, it's, would be roughly $40,000 for a full-time employee plus benefits. So now you're getting up there. So then you have 9 people and then a transport car. So you mentioned yesterday that you had about $1 million in the budget. One of the fellow legislators said that, well, it would be up to 2 million. And I just want to make sure that was misinformation. I mean, that, you can do this with 9, not 18. The person said that it was 18 that you would need.
Right, based on my math, which we looked at, I think we can do it with 9 people with the possibility of a per diem for those times when someone is on vacation or out sick. We have to account for that. But I feel confident right now that we can do it with 9. I think 18 people, 4 people per shift seems like excessive to me.
All right. And
Mr. Chairman, I had a number of legislators call me after the meeting last night, not understanding, and they said, okay, we rethought about it, but again, Mike Aim was right. I can do emergency powers in January, but we all know that's not efficient. I'm gonna have to do emergency bids. I would do the RFP, move forward on it, bring it up to, like Michael, you said, put it up to the vote, general vote, you guys can vote no on it then, but don't delay this, in my opinion. You guys can do what you want, but I will tell you, I don't know any legislator at 21 that is out on the scene for a homicide a car accident, a fire, like I have, and you're waiting for somebody to pull somebody's human remains and give them some dignity. You don't want to get stuck in that mess, guys. This is not worth spending your bandwidth on this. Let our professional do her job and go up to a vote on it on the general floor.
One last
One
comment.
last. Thank you very much. Thank you, Mr. Chairman. Listen, I agree with everything the executive said. And I certainly agree that we have a top commissioner. Thank you for your work.
Thank you.
But I think, to your point, Mr. Amo, that I think we can do this 30, 60 days from now. We can get it done if we need to before the end of the year. We could do two things at the same time, do budget, we could do this. Here's my concern. You do this, bring it to the floor, you vote on it, get the paperwork out there. Minimum calculation, okay, with benefits, get you to well over $500,000. Could be 6, 7, 800,000. They can calculate it, they'll have the data, and then they'll be able to put bids in. And who would put a bid in for 135,000, which is what the cost was at 250 per, when they knew we were gonna do it's gonna cost us 800,000? All of a sudden, the bidders have information that's gonna disadvantage this county and this county's taxpayers, and I am not willing to do that. I'm willing to wait a month, I'm willing to let an RFP go out there, I'm willing to have them respond back to the RFP, and I'm willing to do this if we need to a month from now, or 2 months from now. That's my position.
All right, been a lively debate on this, and I will call the question. All in favor? Say aye.
Hi.
All right,
Aye. All opposed?
Post.
Motion carries.
Motion
fails.
Fail.
I'm just saying.
It requires
The legislative manual
Oh, it had to
requires
be,
the majority of
unanimous.
the members of the committee, not the members present.
Okay, okay.
Do we have a form?
You have,
Yes.
So,
What is that number?
There's 7 people in the committee, 4 are a majority, so 4 had to vote for the motion to pass.
okay.
So the RFP could still go out, correct?
this has nothing to do with.
Right. Thank you.
So the RFP will go out and, how do we get it back to the floor then? Betsy, do we bring it back next month?
The question has been asked and the motion failed both in PNC and in this
It
committee.
goes into,
It failed in PNC and in this committee, so. That's it. I can do research to see if we can bring it forward in another committee.
Point of information, I'll say what I said before. The motion can be reworked by the person that has the motion. And if there are changes, they can always bring it back. So RFP can go out, they can get information on the RFP. If needed, they can come back to the committee with a reworked motion.
If there are revisions in the legislative request, it can come forward again in different form if it's not the same legislative request.
Can I go to the floor as a consent resolution in front of all the legislatures?
Langdon,
No.
we'll recognize Langdon Chapman.
I don't practice parliamentary procedure much, but just out of curiosity, it sounds like you want to talk about this next month. Why wouldn't you move to reconsider the vote? You bring the matter back to your committee, then move to table and bring it back next month. Is that parliamentary procedure appropriate? I'm thinking Ulster County from 10 years ago, I used to be there, legislative council.
But it just failed.
But you're saying you move to reconsider the vote, you bring it back, then you move to table, and then it's back to your committee next month. It sounds like that's what you wanted to do anyway, more than anything else. I'm just giving you a parliamentary route that I think meets Robert's rules criteria, but I haven't done this in a while.
All right, let's do that.
You could make a motion to reconsider currently. It would require, the motion would require all 4 to vote yes. Then you can take the vote, either make a motion to table at that point, and then it has to be a specific time frame, and then you can. vote.
So somebody will make a motion to recall the vote.
To reconsider, yes.
Point of information, when is the RFP going out? When are responses back? By, what's the mandatory date for responses to come back?
What did you say?
Where's the majority of the proposal, unless it has something to do with doctors?
The RFP is going out by next week, and we anticipate about 30 days.
It's pretty soon.
End of September. About.
Mhm.
You'll get some responses, you're thinking. By the end.
We're hoping so,
Yeah, no,
yes.
that's what, and then processing and the another one. You might be able to get one by the end of it. If everything works.
Okay, so Betsy,
Yes.
right now, we would need a motion to recall,
To reconsider.
to reconsider.
I'll make the motion to reconsider the vote on item 3D.
Okay,
Second.
have a second.
I'll second. I have a point of information. Point of information is it was, I should have known that all those years, but I didn't know that. He said, is that if all four of us had voted, it would have passed.
Yes.
And, or if the chairwoman had joined in and voted with it would have passed. I didn't think of it. I thought we had 3-4 was gonna pass, so I didn't know that. So now that we're calling again, we may want to consider all four saying yes, just to make sure it gets on the floor, that's what we want. Or table, it doesn't make any
Well,
difference to me.
my,
If you're willing to change, then
yeah, I hold the cards.
you vote.
My take on what Mr. Chapman said is we are reconsidering for the purpose of someone making a motion to table.
And if that fails.
Correct. If someone's not making a motion to table, I'm not changing my vote.
It's been.
I'm making a
And I
motion.
second it.
All right, we have a motion. on the
I already
floor
made the motion to reconsider. Did we
Reconsider,
vote
not
on
to
it?
table, not to
That's
table,
up.
reconsider.
To reconsider.
And
And
Michael
we have a
seconded.
second. All in favor?
Aye.
Aye.
Now I make a motion to table item 3D to next month's Health and Mental Health Committee meeting, the September meeting, or October meeting, I said, sorry,
Right, can I get a second?
September meeting, yeah, September, sorry.
Have a second?
You second that? Table it to next month's
And
meeting?
poker, Mr.
Oh, please.
Yeah, I'll second.
Thank you.
Okay, so discussion on this. So now we're at the point where we're gonna vote whether we're gonna table it, which I thought was what we were gonna do to begin with what the chairwoman suggested. And I would have done to begin with. We should wait, let the RFP go out and bring it back.
How many votes do we need to table?
Four.
Four. So before anybody changes their
I
mind,
know, well, you'll vote for that.
the magic.
Well, I made a
I don't
motion.
have to vote.
You seconded it, right? Can we get a second?
yes, Michael Amo, second. Before anybody changes their mind, I call the question. All in favor, say aye to table.
Aye.
Aye. Aye.
Sorry.
Motion carried. All right, now we'll get back to the regular stuff. We have item 4. Catherine E. Benelli, Chairwoman, Orange County Legislature.
Monthly report.
Oh, monthly report.
He's sick of me. I've been here long enough.
We've been hanging out all day.
We're never sick of you. Don't
Never
ever say.
sick of you, no.
I'll try to go over this pretty quickly. So as far as infectious disease, we talked about COVID, which is on my list, but wasn't in what I sent to you. As far as pertussis, which we've been talking about, whooping cough, we're updating the Gesund, which is a publication that goes out to individuals and healthcare providers. That's culturally informed information about vaccines. That was originally released years ago, I want to say 2016. So that has been updated. We're excited about that. And we're running an ad campaign encouraging childhood vaccines that will be culturally appropriate for that population. I want everyone to save the date for our Orange County Health Summit. It will be October 12th, about 8:30 to 1. We'll have a couple speeches in the beginning and then have breakout sessions to discuss topics of interest. I'm really excited about it. It'll be at SUNY Orange. Hopefully you've all received save the dates. If not, let me know, and invitations will be following. We've also started a health department podcast called The Healthy Hour, but it is not an hour long, so don't let that stop you from listening to it. We've had 3 episodes so far. They're on YouTube. We do some interviews with community members. We did a summer health one that's really good. They interviewed me for the first one. It's horrible. So episode 2 and 3 are great. we talked enough about the medical examiner, so I'm gonna skip that section. We've already talked about all of that here today. And then in good news, we were recently recognized as an age-friendly public health system by the Trust for America's Health, and I have a little blurb there based on commitment to the health and well-being of older adults in our service area, as based on our action plan and the 6 C's framework. So we're really excited about that. A lot of staff played a role in that recognition. It doesn't mean our job is done. We still have a lot of work to do, and there are things that we said we would do as part of that. So we're going to continue on. And then we'll be celebrating Hispanic Heritage Month, which is September 15th to October 15th. We're going to have some outreach and resources at local libraries, and we'll have more information about that as we move into September.
Great. All right, that's great, and I think that you may want to stay around. We have Katie coming up now, item 4. Thank you for the update. Thank you for all your
Thank you
work
very
getting
much. Thank you.
through this.
Thank
Thank you, Deputy. All right, item number 4, Kathleen Dinelli, Chairwoman of Orange County Legislature. Resolution appointing Anjani Mathada, MD, the Board of Health of Orange County Health District, pursuant to sections 343 and 344 of the Public Health Law and section 7.04 of the Orange County Administrative Code. Can I get a motion in a second?
So moved.
Martel? I'll make that motion. Second. All right, yes, Carolyn.
As you all know, and actually 3 of you have been on this particular committee that are sitting here this afternoon.
Yeah.
The Board of Health of the Orange County Health District. It is a 7-member board. It includes the chairman of this particular committee, along with other individuals in the healthcare industry. We do have a paramedic, and we do have some other doctors that are affiliated with various different facilities, and also a healthcare facility. We do have 2 vacancies. I want to here again applaud the efforts of Dr. Pointer. When she came on board, this is one of the things that she addressed pretty quickly. We did think we had a full complement of a board. However, we did find out that one of those people had previously resigned, and then someone else resigned. So this afternoon, you have before you the appointment of Dr. Puntada, who is a pediatrician out of Middletown, New York. If you've had the opportunity to look at her resume that's attached to this particular resolution, you will see that she is very, very involved in the Orange County community. As far as healthcare, she has a lot of leadership experience when it comes to something like this. She is the chairperson of the Department of Pediatrics at Garnet Health. She's also the chairperson of the Physician Excellence Committee and Quality Improvement at Garnet Health Doctors, and a member of the Physicians Advisory Council, along with probably about another 4 pages of her credentials. I want to thank Dr. Pointer for bringing her to our attention. There's not a lot of doctors that I know that were interested in all of this, and she has been an excellent resource to be able to fill the positions on this committee. So I highly do recommend her and would ask for your vote.
I support it all, and I'm really quite excited. We're able to have a pediatrician caucus now.
Yes.
They can have their own caucus.
They can have their own caucus.
Well, you can populate your caucus because I need another one. So if you have any questions for me, I'd be happy to entertain.
Not here. Yeah, no, I think that would be great to get the Board of Health and full steam ahead. And not hearing any other questions or comments, or call the question. All in favor, say aye. Aye. All opposed, motion carries. Thank you, Chairman.
Thank you.
Thank you. All right, next up, item number 5. Michael Amo, legislator, chairman of the Valley View Advisory Committee. on down, you're down already.
I'm down here.
All right, 5A, report to the Orange County Legislature, Catherine Benelli, Chairwoman by the Valley View Advisory Committee.
I believe everyone in the committee has a copy of this.
Yes.
Before you go into the details, I can tell you, we've spent over three and a half, almost 4 years with Jimmy O'Donnell and myself working on various people trying to describe how we might use the supplementary property at Valley View to do a lot of good things for the county of Orange and all its residents. So that really was the order from the county legislature 4 years ago to begin that process. And what you see is a summary of what we talked about over the 4 years. I wrote it, I tried to distill it down into something that got focused on certain things. Basically, we established the need in the beginning by talking, when Anne Marie Maglione talked about the number of senior citizens of the age that we need to worry about, the kind of services we need to have in the county. Then we kind of talked about why that was important. You can see that. And then the group generally came up with looking at what they called intergenerational continuum care campus. And that really gets kind of confusing, but if you can envision a piece of property where a developer would provide for the county of Orange, you'll hear that later. Orange County is not thinking about doing this. We're looking for the developer to do this for us. At least that's what the committee wanted to do. And that would actually have the various components of delivery of aging services, so the residents of Orange County could age in place better. What might that include? And we talked about 3 areas of that. It might include some form of housing. There may be housing that would hit all generations and all age groups and all conditions. It may even span the economic spectrum. We don't know the answer to that question now. You could have senior housing, you could have housing for veterans, you may have condos. We don't know what a proposal is going to make to us, and it will be the legislature's determination to accept whatever is proposed. We also know we need the infrastructure, and that we know is probably a strong suit there, and but we need to make sure that's really put in place, roads and water, sewer, and those things that are in the next paragraph. And then we need to talk about the kind of services that we need to have provided by the contractor that comes in to do that. And not that exciting, some of the things that were needed. I mean, there was some talk about a welcoming center. Those of us that have gone from state to state, come in and say, welcome to Nevada, welcome to Utah, or whatever it is. And you go in and they tell you all about what's going on in that state. And envision if you were trying to plan your aging, because maybe I have at my age, what I'm going to do next. Is that, where do you go to get that information? The Office of the Aging has a program, but it's just one small one. Where could you go to get a full-blown discussion of what's available in the whole county or the Hudson region for you to age appropriately, at least the way you want to age? I don't think many people can answer that question. I think a welcoming center on the campus made up of individuals, not our county employees, but maybe some department, so would provide that for people. Would say, here's what we have here, but there may be some places elsewhere that would suit your needs better. So it's a comprehensive one. Can you imagine having, this is Anne Marie idea, could you have a market in a cafe? Just I'm giving you some examples so that people who don't really know how to, as they age, to prepare healthy meals could learn that. Maybe we could incorporate it with the Meals on Wheels so people could come. Anne Marie even suggested if it was a regular cafe, you could get a coupon from Meals on Wheels and go eat there. And so it would bring a different sense to people. So there's how do you help people eat nutritionally? What about veterans' needs we talked about? What about physical fitness? You can imagine housing and also ancillary services. If you know that population needs physical therapists, et cetera, then would they be willing to come on if the building was available? Would they be willing to come on and work to provide that service for people? The big seller that we talked in here is that at the bottom, the goal of the comprehensive, what we're asking for is a comprehensive master plan. I'll get to that in a bit and a little more, but the goal of that is to focus on clear vision of the size, scope, function, and image of this proposal. and that it would, the county, and it would benefit Valley View. That, and if you think about this for a minute, the concept is that if you have an active intergenerational aging community, if you will, that they are sitting walking distance to a skilled psych center, or a skilled nursing center and a rehab center. You got the integration. It's not connected, but they're there. Those of you who have looked at continuing care communities, for example, one of the exciting things about that continuing care community model out there, and I think Glenn Arden is up in many more of them. I think maybe he's got different names up there, but the idea that you buy in for a certain amount and you get all your care all the way through skilled that you need it. That is not really working very well for financial reasons. Can you imagine what a developer would do if he looked at this property and said, my gosh, next door is a state-of-the-art, high-end skilled facility with a rehab unit that the people that come to live here could access. Now, the people that come to live here can also access it, because where do you get home health care? So there'd be that integration between the community and Valley View, which I think can only support the growth of Valley View, can only help Valley View be stronger. So that is one of the real key things here. It's not trying to compete with Valley View in any way. Essentially, what we're proposing in this, we the committee proposed, is sort of a three-phase process, and I'll make it real quick so you know what it is. Basically, we want to put on an RFP, which is 99% done. It goes through general services. Sam here is working hard on it. We've got input from all parts, all departments and people in the county. We try to mature it the way we want it. That will go out to go out, and it will look to find someone that will build the master plan for us, which Mike Paducah's asked for a lot, and also a visual image of what this campus could look like. It will not build it, the first RFP. It will give us the complete picture. That idea is something we don't have anybody in the county to do for us. We have to get somebody to do it. So when we come back and put a tabletop for you, and you could see what we're really talking about at the end of that RFP, how it will all integrate, and how it might be paid for, what kind of reimbursement might come in, all that stuff would come up through the RFP. Once that was sent out, we would then be looking to select the person to put this together. And then when it was put together, we moved to phase 2 of it, and phase 2 would really be, how do we find the developer, the person who wants to do this? Once we've got the model, is there anybody in the country that would think they would like to come to Valley View and look at the 140-acre piece of property within commuting distance to Manhattan that sits there, that they could build a state-of-the-art aging community for us and find it profitable? There may be people, and we've talked about this, there may be people who build senior housing and would see this as an opportunity to come in and build senior housing and ancillary services to that are profitable to them. There may be somebody that would come in and want to build a continuing care community that's profitable. There may be somebody that would come in that want to build something for a unique operation for people with special needs or handicap. We'll get to see all that as a legislature, and we'll decide whether or not that's the thing we want to do or not. But that's the phase. And the last phase is, if there is someone, how do we manage it? And it goes back to what the legislature set up. There will be a combination between the Health and Mental Health Committee and the Valley View Advisory Board committee we proposed would form sort of the steering committee in some way. And that would come out later to see that this thing gets rolled out the right way. So that's as quick as I could give you a proposal of what you have in front of you and what we did over the last 3.5 years.
Well, thank you, Michael. I know that you and the advisory board have really put a lot of effort into this, different presentations over the years, and I thank you so much for that. Now, yeah, we're going to go down to 5B, and that's resolution authorizing the Commissioner of General Services to issue a request for proposals for development of a master plan for an intergenerational continuing care campus at the Valley View Center for Nursing Care and Rehabilitation. And I'd like to get a motion in a second for that. Montel. Emo. Okay, Does anybody have anything to add to that? Yes, Mike.
Thank you, Mr. Chairman. Thank you, Michael, and I thank the committee for all the work that they did. How many years? 3 years? 3.5 years?
3.5, 4, something.
Good. Excellent work. And I love, you put together this report
Yes,
and it was approved by the committee.
yes, oh, yes.
Yeah. But,
Many times reviewed and approved.
Good. Outstanding. I loved everything in here. And actually, the one sentence that I loved more than anything else is the one sentence that you loved more than anything else, because you highlighted it in dark black. It says, "To better serve Orange County residents and sustain Valley View Center for Nursing and Rehabilitation." And I'll tell you why that's the line that I love the most. Because as you can imagine, all the shenanigans that went on here 10 years ago with two administrations trying to get rid of Valley View, I still have people that do not trust you guys would do. And
Amazing I said that, right? Since I chaired the committee to something.
so there's still constituents and residents out there that question me on this, and I'm like, no one's going after Valley View anymore. Valley View's okay, and this shows that we're trying to strengthen Valley View. That's what you're trying to do, and that's what that one sentence says. So I'm gonna come back to that in a second. Our resolution, just a little housekeeping here, the second whereas by resolution 83 of 2022, the mission of the committee was amended to address the feasibility of establishing a long-term care services campus on the county owner property. I think you meant owned property, so the R becomes a D. And on the now therefore be it hereby resolved that the Orange County, I think we have one too many that's there, so we can get rid of that. Otherwise, it's perfect. And I tell you what, I'm gonna ask for a simple amendment to this to include a few words. And with those words, I can support this moving forward. And I think then we can stop people from out there, the conspiracy theorists, from weaving their conspiracies of what's gonna happen to Valley View. So what I would like to do, and I'm gonna make a motion, is on that, now therefore be it hereby resolved that the Orange County Legislature, upon the recommendation of the committee, comma, I'm gonna add at that point, after the comma, and to better serve Orange County residents and sustain Valley View Center for Nursing and Rehabilitation, another comma, authorizes the issuance of a formal request for transfer. So I'm
What's the
taking,
last comment?
it's just, we're putting, there's already a comma after.
Oh, then just
upon-
leave that in there. Okay.
Upon the recommendation of the committee, there's a comma there, and we add the words and we put your sentence,
Perfect.
and to better serve Orange County residents and sustain Valley View Center for Nursing and Rehabilitation. Put another comma at that point, and then it continues, authorizes the issuance of a formal request, and so on and so on. So I make a motion to add those words into this resolution.
I'll second you.
Thank you.
Because it makes sense. That's exactly what the committee thought about. We were very serious about it. We talked about it. And,
And it's right there in writing in the resolution. Nobody can question it. So
yeah, and the exciting thing is it really is for Orange County residents. This is for Orange County residents. I mean, and that's the beauty. There's a lot of people that talk about the need. Okay, thank you. So yes, I accept that. So if you want to have a motion.
You know what, I just have one question about that, because I know it came up when, that Valley View is to other residents. And they don't have to be from Orange
they
County.
don't have to be
So
educated.
even though you're just saying this in terms of generally, that it's up for the residents of Orange County, not stipulating that it's only Orange County residents that would be allowed to.
Oh, it's not only,
No.
but what the difference really is federal law does not allow us to select people by any.
Based on the
Federal-
residents.
Excuse me?
Okay,
Based on their residents.
Based on your residence or your payer source.
all right.
You've got to come in, and that's why we have this, when we talk about Valley View, we say it can't just be for Orange County residents.
Right.
In this case, we could decide, we could give priority to Orange County residents if we wanted to. It's only an insurance question, this is not a Medicare or Medicaid.
That statement does not, the Orange County residents does not directly tie in with the Valley View part. It's this whole concept of what they're doing is there to better serve Orange County residents and sustain Valley View.
Yeah,
That's right.
I get it. Doreen, did you get all that?
I do have it here.
You do? Okay, no other comment. I'll call the
So we
question.
need a question on the amendment, right?
The amendment-
Amendment question on the.
Well, Mike,
I made the motion, Mike
seconded.
seconded.
And Lori, do you have any comment?
No.
No, so I'm calling the question.
On the amendment?
On the
On the
amendment.
amendment.
Okay, okay.
So
All in favor?
Aye.
Aye. Any
And now we
opposed?
have-
No?
now we have to vote on the,
Hey,
As
vote on
On
it.
the actual
on,
RFP.
As amended, right?
yes.
Yeah.
On the resolution as amended.
Okay, we'll take a vote on the amended resolution for the RFP. All in favor?
Aye.
Aye. Okay, motion carries. That's.
One time. I just want to end it by thanking, this was a collaborative effort that I had never seen happen before. Every county, leadership in the county worked on this committee to bring it together. And I think we worked with everybody. If somebody wanted to take from county exec's office, to chairwoman's office, to members of different departments, and we came up with something that we all thought we could get agreement on. I think we got to that collaborative moment. We found the need, and I think we're trying to solve it. So thank everybody.
Brought experts in and they all gave nice presentations. And Chairwoman Finelli.
And I don't think any of that would have been possible without your leadership and tenacity.
Without what?
Without his leadership,
Oh.
he was relentless in moving this forward to
Yeah.
bring this to today's vote. It's very important. It's going to be a game changer for this county. And I can reflect back when I started in this legislature 13 plus years ago, we talked about just like this. So it's a pleasure to sit here this afternoon, seeing the fruits of your labor being justified. So
Congratulations, Michael.
I think this will make a very big,
With that being
big
said,
difference.
I'd like to take a motion to adjourn in a second.
So
I know.
All in favor?
Aye.
Aye.